Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, India, would like to welcome you all in my Ayurveda Academy channel. Today's class is regarding the Charak Uttarardha. And in Charak Uttarardha, there are three sthanas: Chikitsa sthana, Kalpa sthana, and Siddhi sthana. Basically, Chikitsa sthan, 30 chapters are very important in our medical practice because Charakastu Chikitsite, whichever the principles mentioned in the Charak Sutrasthan and Charak Chikitsasthan, they are very useful in our medical practice. In the Kalpasthan, they have given the discussion about the different formulae or recipes from the different herbs, which are very useful for giving the Vamana or for giving the Virechana. And then after Kalpasthana, Siddhisthana discuss with the basically the Vyapad or Vyapat. That means the complications when we are giving the Vamana, Virechana, Basti, etc. So today, fourth chapter of Siddhisthana is management of the complications of Sneha Basti. Here, lot of printing mistakes are there. Please excuse me and forget about that. Forget and forgive. This is the very interesting. You concentrate on the English language. Management of complications of Sneha Basti. Okay. Anuvasana Basti. You know there are basically two types of Basti. First is a Anuvasana, only with the oil, and second is a Niruha or Asthapana. Anuvasana Basti is given after taking the food. Anuvasana Basti is not given on empty stomach. Okay, but Asthapana Basti is not given immediately after food. After digesting of the previous food, Asthapana Basti is given. That is also one of the difference. Okay, but Basti is in general very, very useful for Vata Prakopa or Vata Janya Vyadhi. That means mainly the musculoskeletal and neurological problems. So today, first we are going to discuss about this Sneha Vyapata Siddhi. Just I have to adjust my screen every time. You will excuse me for that. Okay. So these are the basically complications when we give the only oil enema, because the medicines is called as Vatavrita, Pittavrita, Kaphavrita, Ati Annavrita, Purishavrita, and Abhuktavastha. So my dear students, first you can see, we will go a little bit down and you can observe that table. Basically, it is better to observe symptoms of complications of improper Sneha Basti, that is Anuvasana. Here I will wait for few minutes for you. You only write down like this. Give the title. Open your notebook. Come on. Open your notebook. Today's date is 7th of November 2023. You prepare separate notebooks for each subject for Professor Deshpande's notes with the YouTube videos and all these things. So what I am dictating you or telling you to write down here, I will mark for you. Not everything. Don't write everything. Only title. Give the title. Symptoms of. Please write down. Symptoms of complications. No? Vyapad or Vyapat, Sanskrit word. For if you not give the proper Basti, that is Sneha Basti. Anuvasan Basti is also called as Sneha Basti. Okay. So you give the title and then only you write down these 6 names. Only 6 names. Maybe English, Hindi, Marathi. This is Devanagari script. Vata Vrita. Avruta means covered. Avruta means covered. You write down Avruta, covered. Vata Vrita, Pitta Vrita, Kapha Vrita. That oil, whichever we are pushing, is getting obstructed or it is being getting covered with these problems. Vata Vrita, Pitta Vrita, Kapha Vrita, Ati Anna Vrita. Please write down. Everybody should write down. Purisha Avruta, which is also called as Mala Avruta. Avruta is a covering. Okay. उसने ढकेलना उसके साथ. Abhuktavastha Pradatta. Abhuktavastha, without taking any food, Pradatta. What will happen? Because Anuvasana always should be given after food. Remember this thing. So I hope you have written these 6 sentences very fastly. And now, before seeing its symptoms, we will first try to get understanding of what is these 6 complications of Anuvasana Basti. Focus. Focus. Okay. Vatavruta. Medicines can be withheld. That whatever the oil we are pushing by aggravated vata, when cold, that whole Basti dravya oil is, you are using cold oil or small quantity of medicine is administered, then this problem arises. Vatavruta. Second is Pittavruta. When medicines, that whatever the oils you are giving with the glycerine syringe, please write down glycerine syringe 100 ml. Usually we give Anuvasan Basti only 60 ml. Write down 60 ml. Okay. Now here I should remember you. Professor Dr. Deshpande has mobile app. And what is the name of mobile app? Ayurveda Academy. So how I can find? Go to Google Play Store. Google Play Store. There you type Ayurveda Academy. And then you will get, this is my program of Professor Dr. Deshpande. 15 programs are there. We are talking about Panchakarma. Excellent videos are there. Excellent videos. All PPTs are fantastic. And everything is for your practice. So I request all of you, don't miss that. You purchase that program, go on studying with the mobile, and you will be very, very happy and you will be confident for doing the Panchakarma. Okay. So Pittavruta, when medicines administered are very, very hot, that is oil. Kaphavruta, when medicines administered are very, very mrudu. Then Ati Annavruta, if dravyas which are guru, whenever you administer without understanding the prakriti of the patient or the disease of the patient, if you are giving heavy medicines, then that is Ati Annavruta. Guru means difficult for digestion. Purish Avruta, medicines which are not strong or potent, or if administered in small quantity, it is encroached by the excess malas and causes the complications. Abhuktavastha, if Anuvasana Basti is administered when patient is on empty stomach, that is not correct. Medicines reach higher levels up, causing the complications. So these are the explanation what is meant by this Vata Vrutta, Pitta Vrutta, Kapha Vrutta, etc. But basically, you should remember these names at least to begin with. Now we will see again downward slowly and steadily. Don't be hurry. We will try to understand the symptoms. What will happen? When there is a Vata, Vata always causes the pain. Angamarda, whole body pain will be there. Fever will be there. Adman, gas in the stomach, fullness of the abdomen. Then Shita, the patient will feel little bit cold. Stambha, whole body parts are like the compact. And what can the spasm? Stambha. Urupidana. Uran, there are different, two words are different. Ura, chest. Uru, thigh. 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 I will repeat. Ura, chest. Ura, chest. Uru, thigh. Uru, thigh. Here, thigh. Urupidana. There will be pain in the thighs. And Parshva, back. Back pain will be there. Always Vata means blindly you can write pain. You can write whole body pain, hand pain, leg pain, whatever, but pain. Then Pitta. Pitta is always burning. Pitta is always burning. Never forget. So Pitta Vrutta, Dah, burning will be there. Raga, inflammation. Raga means not anger. Raga means red color of that part. Red color. Then Trishna, excessive thirst. Murcha. Murcha, fainting attacks. Tamakashwas, bronchial asthma, and fever. Pitta is always with the fever. Okay. Then Kaphavruta. Kaphavruta is a Tandra, like sleepy, drowsiness. Then Shita Jvara, fever with rigor. Fever with rigor, Kaphavruta. Alas, laziness. Praseka, excessive salivation. Lalastrav. Aruchi, because Agnimandi will be there, no appetite, no hunger. Gaurava, heaviness of the body. Murcha, again fainting attack. And Glani, Tandra, drowsiness. Ati Annavruta, then Chardi will be there, vomiting. Murcha, again the unconsciousness. Aruchi, loss of appetite. Glani, drowsiness. Shul, pain will be there. Nidra, sleepiness. Angamar, the whole body pain. And Ama dosha will be created. Ama is like a toxin-like material because of the indigestion. Okay. Purisha Avruta, then there will be Vitta, Mutra, Anila, Sanga. Vitta, Sanga. Mutra, Sanga. Anila, Sanga. Are you getting my point? So, Vitta, Sanga, constipation. Vit means stools. Mutra, Sanga, problem to pass the urine. Urination will not be there. Obstruction, feeling like there. And Anila. There are two words. Again, write down. Anila, Vatadosh. Anala, Agni. Anila, Vat. Anala, Agni. Anila, Vat. Anala, Agni. Confusing words. Remember properly, please. So here, Anila means peristaltic movements will be little bit slow down and aggravate, obstructed. Shula, pain. Gaurava, heaviness of the body. Adhman, like tympanitis, fullness of the stomach and abdomen. Vriddha graha, here the chest region, it will be like the graha means obstructed, like spasm in the chest. Abhuktavastha pradatta, Sneha goes upwards, bhavati urdhva, and is expelled out from the upper passage, like you may get the vomiting. Okay, now we will shift on the left side. Oh, sorry. Just I have to go a little bit up. Please give me some time to adjust the screen all the time. Okay. Sorry. Okay. Here you can see treatment of above complications. When you give Anuvasana Basti, Sneha Basti, oil enema, and you get the complications, you have to give the Niruha Basti. Because Niruha always clear the cleansing. Srotorodh dur ho jata hai. It will remove the srotorodh or obstruction. So Niruha Basti should be administered to expel the withheld Sneha, which is obstructed oil is there, it will be expelled. The Basti Dravya is prepared on the basis of dosha involvement. For example, Vata, Vritta, Snigdha, Ushna Dravyas will be used. And Bruhata Panchamula, Gomutra, these Dravyas will be used for the preparation of Niruha Basti. We are talking this treatment part, treatment of complication. They say whenever problem with the Anuvasan Basti, give the Asthapan Basti. Asthapan and Niruha same. Asthapana and Niruha same. It is more stronger. Asthapan or Niruha contains decoction, kalka, paste, and oil. And Sendha, of course. Sendha is there. Okay. Now we will go further. Matra Basti. This we give very much. Whenever I was visiting to foreign countries, 1993 to 2014, 20 years, yes. We had the center in the Spain, and we were not giving to begin with Niruha, never. In the foreign countries, they don't know and they will not accept. So we will start always with the Matra Basti. Matra means very, very small dose. Like for example, in the Nasya, Pradhamana is a very strong. Pradhaman Nasya. Never try in the beginning. But if you give the Pratimarshanasya, 2 drops only. Very simple, very simple. Pratimarshanasya, simple. Pradhamanasya, difficult. Here also, Niruha Basti, little bit difficult. Matra Basti, very easy. Matra Basti is a type of Anuvasana Basti which is having least minimum dose of Sneha oil. That is Rasva Matra. Will you write down? Rasva Matra, Sanskrit word. Rasva Matra, very little. It can be administered anytime, before food, after food, this and that, any time. Regular Anuvasana Basti, better, not better, but after food. But Matra Basti can be given anytime because it is very less. When we give the Matra Basti, indications in those who have become very, very weak, tuberculosis, cancer, HIV, very weak, muscle loss, weight loss, durbala and emaciated, very weight loss. Weight loss is mainly possible. You write down the 4 important causes of weight loss. Write down tuberculosis, second, cancer, third, HIV, fourth, write down malabsorption, okay? Then krusha, then due to, why this durbal and krusha? Because of the karma. Too much activity, physical and mental, very much, because he has to do hard work for the earning bread and butter. Lot of hard work, lot of day and night labor. That becomes the problem. Vyayama. Nowadays, the young generation are very much freak of the exercise, and they do beyond their capacity. That is very bad. Then bhar, carrying the heavy weights here and there. Adva, too much traveling by motorcycles, even by the aeroplane. Always the corporate CEOs and business people, they will be take the breakfast in the Dubai, then they go for the lunch to London, okay, and for the dinner they will land into the Germany. Oh my God. So this type of the traveling by the business people is also not good for the health, because that can cause the vata prakop, tremendous vata prakop. And then madhyapana, or any vices, smoking, any drugs addiction, and stri prasanga, too much sexual activities, that can cause the problem, and we can give the matra basti for the nourishment of the body. Okay. Now we will go a little bit for the next topic. This is 5th chapter, that is Netra, Basti, Vyapat, Siddhi. My dear friends, don't get confused. Here, Netra is not related with eyes. No. It is Netra Basti. So, whenever we give Basti, there is a typical instrument. Please write down the name of the instrument. Basti Yantra. We have seen that. Basti Yantra, like metallic, and then we put any, in the previous days, they were used to animal urinary bladder, but now we use the plastics. Okay. And that we put the decoction and we give like this Basti. So Netra Basti is not related with this Netra, but that is related with the Basti Yantra instrument for giving Niruha Basti. Okay. Management of the complications due to faulty nozzle and a container. So Basti Netra Dosh, they are 8 in number, defect in the nozzles. Rasvam, you have to learn the shloka by heart. पाठ करून टाकायचा, याद करना है आपको. 10 बार, 12 बार, 100 बार पढ़ना है आपको. जैसे देखिए, रस्वम दीर्घम तनुस्थूलम जीर्णम शिथिलबंधनम पार्श्व छिद्रम तथा वक्रम अष्टौ नेत्राणि वर्जयेत. Here varjayet, avoid. This type of the bad instrument you should not take. Don't take this bad instrument. I will read shloka 2 times. You can take the snapshot, you can record my lecture, put the audio and hear all the time, you will get good marks. Rasvam dirgham tanustulam jirnam shitilabandhanam parshva chidram tatha vakram ashtau netrani varje. Remember the word art, 8 number. Rasvam dirgham tanustulam jirnam shitilabandhanam parshva chidram tatha vakram ashtau netrani varje. Okay. So let us talk about the further description of this. Okay. Just a moment. Please give me some time to adjust the screen. Okay. So Rasva, smaller than ideal size. That particular nozzle. Hole. Dirgha, long than the ideal size. Tanu, very, very thin. Stula, thick. Jirna, very old. Shithila bandha, I am concentrating on this 8 problems. Shithila bandhanam, container is tied loose to the nozzle. It is not, plastic bag is not properly tied. That is called as a shithila bandhana. Okay. Then parshva chidra, opening hole is on the side of the nozzle. Then vakra, it is little bit bent. Vakra. Okay. So rasva dirgha tanastula jirna shithila bandhanam parshva chidram vakram. As I have mentioned, nowadays, you go to your Panchakarma department. Request teacher, sir, I am a learner, I am learning Panchakarma. And Dr. Deshpande, no, you need not to take my name, but tell them, sir, I am very much interested to see the Basti Yantra. I want to see, sir. I want to see the Basti Netra, sir. I want to see Basti Putaka, sir. Request them. There may be senior students. Request the senior students that they will show you. When you see by your naked eyes, then you will be happy. Yes, now I understand what is Basti Netra, what is Basti Puttaka. If you only see this or read this, no use. No use. You have to take your own efforts. Okay? You can make a photo in your college and send it to me with your name and college name. I will proudly show on the YouTube. Oh, this student is helping me to produce his college information in the scientific way for the common people. Okay? Now we will go further. This is about the Basti Putaka Dosha. Previous was Basti Netra. Don't get confused. Basti Netra different. Basti Putaka is a container, plastic bag. In the olden days, I am always telling you what was used. What is the name? How that Basti has come? Basti is literally means urinary bladder. Basti means urinary bladder. And at that Charak time, they were using, because they are very close to the nature, Guru Shishya Parampara. They were learning not in the buildings, not in the college buildings. They were learning in the forest. Guru Shishya Parampara. There, they lot of have the animals. They used to do the hunting for the meat and all these things. So they prepare that container from the bladder, urinary bladder of the animals. Try to understand. Nowadays, nobody is using. Previously, our some Vaidyas, they were using even the, you will surprised to know, but some tried the typical leather from the football. You know the football. So it's like a container. They tried in these different ways. In the Kerala, if you go, they will find the plastic bags. Now in Maharashtra, some people, they use the enema pot for giving niruha or asthapan. And for giving the anuvasana, always write down, glycerin syringe is used. You can see all these things in your hospital, in your college. Okay. Vishama Mausalam, Vishama is another, Mausalam, Chidra Sthula, Jalika Vatalaha, Snigdaha Klinnaha Cha, Snigdaha Klinnaha Cha, Tan. I am reading with Sandhi Vigraha, Tan, Ashtau Bastin Karmasu Varjayet. Varjayet, to avoid. This should be avoided. What is that? Vishama, irregular. That plastic bag or container was a shape not proper, irregular. Mounsal, very much fleshy. Chidra, with lot of holes. Stool, very thick covering that we cannot press it. Then that is problem. Jalika, multiple minute holes are there. Then Vatala presents the air inside. Then Snigdha, very anxious, and Klinna, very slippery or the weight. So these are the bad things, defects in the container. You should remember all these 8, etc. Now we will go further. Again, give me some time. Little bit up. Okay. Now we will discuss about Basti Data Dosh. We are talking about Anuvasana and Asthapana Basti. We have seen the Basti Netra complications or the Dosha faults, defects. Basti Netra defects. Basti Putak defects. And this is Basti Data, technician, Panchakarma technician. In most of the Ayurvedic hospitals, most of the private Ayurvedic clinics, very few places where actually the Vaidya himself or herself is doing the Panchakarma. Very rare. What they do? In the hospitals, in the private clinics, everybody is appointing Panchakarma therapist. So most probably the therapist, if it is not properly trained, then he can do some problems. For example, Basti Data, please write down Basti Data, Panchakarma attendant or Panchakarma therapist. Panchakarma therapist. Okay. Let us see. The defects due to improper administration by physician. Here I have corrected. Here I have corrected. Not every time physician, but maybe technician. Maybe Panchakarma technician or Panchakarma attendant. Okay. So, Savat, Atidhrita, Utkshipta, Tiryak, Ullupta, Kampita, Ati, Bayyaga, Manda, Ativega Dosha, Pranetritaha. Pranetritaha, the person who is giving. Pranetritaha, giving the Basti. They are 10. Previously it was 8, 8. Now this is 10. You have to learn by heart. It will be asked in the examination. Write down the Basti Netra Dosh. Write down the Basti Putak Dosh. Write down the Basti Data Dosh. ASAP. 3 marks, 5 marks. So be careful. Savat, administration of medicine with air. Here I also remember the modern medicine techniques. If you visit to the modern doctors, if they are seeing the injections, they always take the injection from the vial, liquid, and then they push to the deltoid or the tricep or the buttocks. But when you feel that particular dravya, liquid, vial, injection, then while giving the injection, doctor always do take that liquid slowly up and above air is expelled out. And when some drops are coming from the needle, then it is ready to give the injection. So same thing, we have to be very careful that there should not be any air while we push that particular Basti. Atidrut, fast insertion and fast removal of the nozzle, that is not at all correct. Be slow and steady. Utkshipta, nozzle is raised, that above part is raised and inserted. It should be have some proper direction. That is why I am telling Panchakarma is not the theory. Panchakarma is always a practical. So you can just read some material, hear some material, but basically you should be Drishtakarma and Kritakarma. Yes, these are the qualities of Vaidyas. 3 qualities. You will be surprised, this I have written when I worked as a HOD, head of the department and professor in Ayurveda College, Nigri. I write down some slogans on the board, on the wall, painted. And there I have written this, that Vaidya should have the Shruta Karma, good listener attending the lectures, Shruta Karma, then Drishta Karma, you should go to the clinics and see what the doctor is doing. Okay, this, observe. And then finally, he should do it all the things by himself. Kruta Karma. So, Shruta Karma, Drishta Karma, Kruta Karma. Here, the word is Drishta, not Dushta. Because in Marathi, Dushta is not a good word. Dushta means, what I can say, it's not a bad people. Dushta. But here, Shruta Karma, Drishta Karma, and Kruta Karma. 3 are the qualities. Okay. So, Atidrita, this is because he has not practiced properly. Utkshipta, Tiryak, oblique insertion. That is not correct. Then Ullupta, medicines are squeezed by giving some time in between. Pressing, stop. Pressing, stop. Not good. Not good. It should be continuous flow should be there. Otherwise, in between, air will leak. Okay. Then Kampita, while giving the Basti, the hand is shaking. Hand is shaking. That is Kampita, is not good. Is not good. Even while giving the injection, your hands should not be tremor, should not have the tremor. So doctors should be physically and mentally very, very stable, quiet and calm. Stability is more important. Then Ati, very deep insertion. Bahyaga, inadequate insertion of the nozzle, just keeping at the anal opening and not going inside. Then Manda, very slowly pushing. That is not correct. ati vega, very fast pushing, that is also not correct. So these are the problems created because of the Vaidya or the Panchakarma therapist or Panchakarma attendants, whoever is giving the Basti. These are the 10 in number. Okay. Let us go slowly up. Check the screen. Complications produced due to the above defect. What will happen? If Rasva, then medicines do not reach the Pakvashaya. Dirgha, medicines will reach very high. Tanu, there may be injury to the anal canal. Sthula, it will break or make the ulcers around the anus. Ulcers are called as a fissure in ano. Fissure in ano. In Ayurveda, there is another word, parikartika. Yes, write down. Parikartika. P-A-R-I-K-A-R-T-I-K-A. Parikartika. Parikartika. That is fissure in ano. And what is fistula? Yesterday there was reference. It is not here, but I am asking you. Fistula. Fistula is bhagandara. Bhagandara. Fistula in ano. And what is the best treatment? Just revision. What is the best treatment? Yes, Kshara Sutra, medicated thread. Okay, coming back. Jirna, injury to the anal canal. Shithila Bandhana, leakage of the medicines will happen. Okay, now we will try to go further. Okay, just let me allow to adjust the screen for your convenience. Okay, Parshva Chidra, that will also create leakage problem. Vakra, there will be leakage plus pain. Pain will be there. Okay, now defects of Basti Putak. Just now we have seen that whatever the material that we are taking for Basti Putaka, if it is problem Vishama, non-uniform administration of medicines will occur because the covering is uneven, and so at one stroke the medicines will not go. Mausala, there will be foul smell to the medicines in the medicine. Chidra, there will be leakage of the medicines. Sthula, if it is too big, handling will be difficult. We cannot press that Basti Putaka, that is container. Basti Putaka, container. Never forget. Okay. Okay. Stula. Jalika, again, like holes, leakage of the medicines. Vatala, entry of the air into the intestine. Snigdha, again, handling will be difficult because it will be slippery. It will slip away. Okay. Clean, again, very lot of moisture is there. Handling will be difficult. Now, we have seen the defects of the person who is giving Anuvasan or Asthapana Basti. It may be the Vaidya himself or herself, or there may be Panchakarma therapist or Panchakarma attendant. Okay. So, Vata, though the type of the shul, whenever there will be Vata, always pain. Vata, pain. Vata, pain. Vata, pain. Pitta, burning. Pitta, burning. Pitta, burning. Kapha, heaviness. Kapha, heaviness. Kapha, heaviness. Always tricky. Important words you should remember. So, Atidrita, pain in the anal canal, west region, thigh, and stiffness over the bladder and pain in the inguinal region. So, everywhere there will be pain if it is a Atidrita or Utchipta. Then Tiryaka, inadequate entry of medicines. Ullupta, pain in the chest and the head, tiredness in the thighs. Kampita, while giving Kampita, tremor. Then burning sensation and edema in the anal canal. This will happen. Okay. Now we will go further. Here, can you see? Slowly, I am taking you to the proper way. Okay. Ati, burning and pricking pain and incontinence. Yes, I know. I will tell you what is that incontinence. Please write down. What is incontinence? Incontinence. The urination without control. The patient cannot hold the urine. Whenever bladder full, empty, finish. No control of the sphincters. Sphincter control is lost. That is called as incontinence. patient cannot hold the urine till he reach to the toilet. No. There may be even stool incontinence. Whenever there is a sensation of going to the stools, defecation, the patient will not be able to hold that particular waste product or the stools, and he will pass into the undergarments, and that is a problem. Incontinence is a bigger problem. For the urination, at least now you have seen that there are the diaper undergarments are available even for the adults. Previously, it was only for the baby, na? Up to 6 months, etc. We put the diaper at night so that there should not be wait or beds and all these things. But now the diaper pants are available for adult also for this particular problem, incontinence. Whenever they want to go for tour, trip, 1 hour journey, 2 hour journey, and they are not able to hold it, then diaper pants are the best. Bahyaga and Manda medicines does not reach the Pakvashaya. Pakvashaya is the large intestine. Ativega, very fast. Medicines reach very high and will not be excreted. Okay, so these are the problems of that Basti Netra, Basti Putaka, Basti Data. My dear friends, we have still some time in our hand. So I will discuss some of the other points that are coming in this particular adhyay, and that is a sort of, we have discussed the Charaka Samhita, Siddhi chapter number 4 and 5. Okay, so something I will make for you. Just a moment. Yes, we have started from this point. So I will try to give you some as a type of revision or as a type of some other information, because we have some time in our hand. I request all of you, please open your whatever the textbook that you have purchased. I have always, in each video I am saying that each student must purchase minimum 1 textbook of each subject, maybe Marathi, Hindi, English. And then you make a habit to read the question papers, previous question papers many times, and also read the index of your textbook 100 times. Reading of index makes you knowledgeable. Yes, I am telling you frankly, try it for it. Now, for example, Charaka Samhita Kalpasthan. There are 12 chapters. What are those? Please open your textbook and read. Madana Kalpa Adhyay for woman. Madan Fal for woman, vomiting. Jimutaka Kalpa, which is called as a Devadangri in Marathi. Jimutaka Devadangri. That is for woman. Ikshvaku Kadu Dudhi Bhopala. Bitter gourd. Kadu Dudhi Bhopala, Ikshvaku for woman. Then Dhamargava Kadu Ghosala in Marathi. Dhamargava Kadu Ghosala. Bitter taste are always irritating and makes the vomiting. Okay, Dhamargava is also for Vamana. Vatsaka Kalpa, that is for Vamana. Then Krutavedhana Kalpa, that is also for woman. So 6 plants are there. Madana Phala, Jimutaka, Ikshvaku, Dhamargava, Vatsaka and Krutavedan, 6 for Vamana. I am talking about Kalpasthan. Next 6 are for the Virechana. First is pair, Shama, Trivrut. Rather, two varieties of the Trivrut. Trivrut is a Nishottar. Trivrut means Nishottar. Trivrut Leh is available in the market. Please write down. Trivrut Leh. Leh is a jam, like Chavanprash. So Trivrut Leh, 2 teaspoons at night can give you the very good Virechana in the next day. Then Chaturangula. Virechana. Chaturangula, that is Bahava. Please write down. Chaturangula, Bahava or the Dhamargava. Chaturangula. This is a type of revision, my friends. Tilvaka Virechana. Tilvak means Lodhra. Then Sudha Kalpa for Virechana. Sudha Kalpa means Snuhi. The name of the plant is Snuhi. Snuhi Sudha. Okay. Then Saptala Shankini. Saptala Shankini Virechana. Danti Dravanti Virechana. Danti Dravanti Virechana. Okay. Now, for Siddhisthan, just open your notebook, book, and see the chapters. See the chapters, name of the chapters. First is a Kalpana Siddhi. Kalpana Siddhi. Second, Panchakarmiya Siddhi. Third, Basti Sutriya Siddhi. Fourth, Sneha Vyapat Siddhi. Vyapat means, yes, complications. Fifth, Netra Basti Vyapat Siddhi. Sixth, Vamana Virechana Vyapat Siddhi. Next time, remember this, next time. Vamana Virechana Vyapat Siddhi. Seventh, Basti Vyapat Siddhi. 8. Prasruta Yogiya Basti. Prasruta Yogiya Basti. 9th, Trimarmiya Siddhi. Trimarmiya Siddhi. 10th, Basti Siddhi. 10th, Basti Siddhi. 11th, Phalamatra Siddhi. 11th, Phalamatra Siddhi. 12th, Uttara Basti. 12th, Uttara Basti. Now, here I will give the passing comments. I request all of you, Siddhisthan, Siddhisthan, please write down, please write down. Chapter 11, Phalamatra Siddhi. Chapter 11, Phalamatra Siddhi. There is a Pashu Chikitsa. Very interesting. Pashu Chikitsa. Please write down, Pashu. Pashu means animal. So this chapter is dealing with the veterinary science. Very interesting. Charak Siddhisthan, chapter number 11. Charak Siddhisthan, chapter number 11, veterinary science. Veterinary science related with animals. Animal treatment, veterinary science. Charak Siddhisthan, chapter 11. Very interesting. And Uttara Basti, last chapter. What is Uttara Basti? Uttara Basti is a basti given through the male or female genital organs. Will you please write down? Through the genital organs. Uttara Basti means basti, dravya, given through the male or female genital organs. For example, please write down, for example, given through the urethra, penis. If you push the dravyas, that is called as Uttara Basti for the male, M-A-L-E, Purusha. And if you give through the vagina, that is for the females. Mainly this is given for the genitourinary problems. Uttara Basti. So I have discussed some very important point. Chapter number 9th, please write down. Chapter number 9th, Trimarmiya. In Trimarmiya, 3 marmas are discussed. 3 marma. Don't forget 3 marma. Charak Siddhisthan chapter 9. Charak Siddhisthan chapter 9, 3 marmiya. What are 3 vital points or vital organs in our body? Please write down. Rudaya, heart. Rudaya, heart. Then Shira, brain. Rudaya, Shira and Basti, not only urinary bladder, but urinary system, especially kidney. So their information is given regarding that particular organs and how we can treat the problems related with Rudaya, Shira and Basti. Rudaya, Shira and Basti. Okay. Now, I will just try to tell you Charak Chikitsa, the name of the chapters. Please see what, because we have the 1 or 2 minutes. Write down. First is a Rasayana chapter. There is a 4 sections in Rasayana chapter. Prathama Pad, Abhaya Amalaki Rasayan. Abhaya is Avla. Abhaya is Hirad. And Amalaki is Avla. Abhaya Amalaki Rasayan Pad. Second, Pranakamiya Rasayan Pad. Third, Karaprachitiya Rasayana Pad. And fourth, Ayurveda Samathaniya Rasayana Pad. So there are 4 sections in Rasayan chapter. Second chapter is Vajikarana, that is aphrodisiac, sex, education, infertility problems, Vandhyatva problems. The 4 sections, Prathama Pada, write down. Sanyoga Sharamuliya Vajikarana. Sanyog Sharamulya Vajikaran. Second, Asikta Kshiri Vajikaran. Asikta Kshirika. Then third, Masha Parna Bhratiya. Masha Parna Bhratiya Vajikaran. And Chaturtha Pad, Pumanjat Baladik Rasa Vajikaran Pad. So, my dear friend, this is the exact time of 3 o'clock, and I should take your leave because we are ending on the 7th of November 2023 the very interesting lecture about the Charak Uttarardha, and we discussed about the some chapters from the Siddhi Sthana. So soon after completing this section, we will meet for the next lecture that is regarding the Stri Roga Prasuti Tantra. So thank you very much. Take care and see you soon.